Hello, and thank you so much for joining us today for the webinar Securing Your Future and Developing Your Practice. We would like to thank Mr. David Foster for being with us today and our sponsor for making this lecture possible. Please take note of any questions and comments you have during the lecture, as they will be addressed by the Mr. at the end of the presentation. Without any further delay, please help me welcome the expert himself, David Foster.
Good evening, everybody, and welcome to this webinar. As has been indicated, we're hoping to cover the topic securing your future and developing your practice. It's going to be a joint effort this evening, myself and Barry Chandler, who's the Imaging Sales Manager at KaVo, and our aims tonight on the agenda are up on screen now. We're looking at the patient and practice benefits of investing in cone beam imaging, and that will be covered by Barry as the expert in that. I will then take over and financial benefits of investing in said technology, and we will probably be looking at around 45 minutes of the webinar with a Q&A session shortly afterwards as well. So as was indicated earlier, please send in any questions you have and we'll do our best to give you the answer at the end. Now, what we're looking at is learning outcomes, and learning outcomes we're looking for this evening are consider the practice and clinical benefits of investing in imaging equipment. Once we've covered that part, we need to look at whether there are financial advantages to be gained from investing in this new equipment. We'll then move on to something called the annual investment allowance. There'll be more detail on that later, but that's tax benefit basically, and how to maximise that, which will obviously be a benefit to your practice. There are a range of finance options available: deferred payment plans, leasing, HP, and all of them can aid practice cash flow and growth. One thing I would say is that don't be confused about the term leasing. Leasing has been used over the years as almost a generic term, and it's kind of like Hoover when people actually mean vacuum. So leasing is quite often mixed up and confused, and in many cases, as we'll show later on, leasing is not what is going to be the best for you. So it's a double act this evening. But I'll just give you a quick background about myself. I'm the founding partner of Braemar Finance, which I did in 1992. I've worked in professions finance since 1984, so there's 30 odd years there. I've got 2 grown-up children, and my work interests include rugby and golf. As you can see from the screen there, the rugby obviously a little bit pertinent to this coming weekend for those of you who are interested. In Scotland have a big match against England, so come on the boys. And I also been a part-time cook. I'm not very good, but I'm very keen. And the dinner parties, I tend to find that drink overcomes any reluctance to eat my food. So if you get an invite to mine, expect more of the former rather than the latter. So about Braemar Finance. For those of you who don't know, we are leading providers of professions finance in the UK. And indeed in the Republic of Ireland, where we've been established now for 2 years. Founded in 1992, so for the arithmetic, we are now celebrating our 25th year in business. During that time, and this was a shock to me when I actually started adding up the numbers, transacted over £1 billion worth of business and assisting professions such as dentistry, optics, vets, to grow, expand in the business plans over that time. We aim obviously to deliver a knowledgeable and personal service to the professions, and we look at tailor-made finance solutions to help you grow. We were acquired by Close Brothers Group in the year 2000, and Close Brothers Group, for those of you who don't know, is a merchant bank, and it's in the FTSE 200 company. I'm going to hand over now to Barry Chandler from KaVo, and Barry will cover off the technical benefits and indicate to you why investing in equipment is a good idea. Barry?
Thank you, David. Yeah, so just a little bit about myself. As David's mentioned, we're having a bit of a double act today, but I'm going to be on for a very short period of this, just to give you a bit of a run through, an overview of what we're really looking at when we're looking at this type of technology. As you can see on the screen, I'm a qualified medical physicist by training. I've been involved with dental imaging for around 15 years, and it's generally been around the 3D imaging of dentistry. First started in doing 2D imaging and then 3D imaging in hospitals. And for the last 10 years, I've really been concentrated on the cone beam CT. 2 young kids and absolutely no hobbies because all my spare time is taken up by the kids these days. A little bit about KaVo. We've established for over a century now, over 3,000 employees worldwide. We're owned by an American conglomerate, Danaher, and we're probably best known for our market-leading handpieces, but more recently for our full range of imaging solutions, which is what we're looking at today. So, a few little benefits to you, the practice, and the patients when looking at this sort of technology. Cone beam's been around for the best part of 10 years now in the UK. And very quickly it became a way of imaging and a modality for dental implants. And I think the dental implant world these days has become almost reliant on this image and this type of imaging to place those fixtures. But we sort of want to go to the next. We want to use cone beam for other means. And some of the benefits, some of the features we have within our software package and within our hardware package will allow us to open up cone beam to other things. We're already starting to see things like tooth impactions, trauma cases going through them, the TMJ analysis as well. And of course, CAD/CAM would not be possible with this current digital workflow and the digital workflow that we're all looking at without a cone beam image. And you know what, it is a great way to interact with your patients. The ability to show them a treatment plan, the ability to sell your work to them becomes a lot easier when it's in 3D and planned up very nicely on the screen. So what have we got in our portfolio that can allow you to achieve all these aims? Well, our latest and greatest cone beam CT is the Gendex DP800. It has a wide range of functionality. It's what we call a 3-in-1 unit, so OPG, a KEF and a 3D, and the KEF part is optional on there. When we come to look at the 3D or the cone beam CT part of the unit, we can see that there's 4 fields of view to allow you to cover all areas of anatomy, from small sectional scans all the way up to the big large scans, covering the large, and even back to the TMJs if we needed to. Dose reduction technology is probably one of our biggest steps forwards when we're coming to look at this latest generation of cone beam. It's the ability to be able to take a cone beam scan at doses of 2D imaging. So for example, for the size of an OPG in 3D these days, we can get that to the dose of an OPG. And this is one of those factors I spoke about, which is opening up this technology to other parts of dentistry. So now, instead of just pre-op implant treatments, we can look at the post-op images as well, because we can now justify the dose and get a lot more imaging in our low-dose cone beam CT scans. And of course, no image is right, especially in cone beam, without a good software package to look at that image and you know, again, to sort of interact with the patient with that image as well. And that's where we utilize the in vivo software. It's a full implant planning package, which will allow us to do everything from simple measurements to full implants and surgical guidance. Well, what should be the motivations for you as far as we need to invest in this technology? Well, across the board, for the 10 years we've been dealing with cone beam, we keep getting the same things come up over and over again. And it's about time saving, ease of use for both you and the patient and the staff as well. The ability to be able to scan your patients in-house, sit them back in the chair and immediately start discussing a treatment plan with them. It increases your treatment workflow, and it also increases your treatment acceptance as well. So just a very quick overview of the technology. That's not the reason for the event today, but a good background to what we're going to be seeing from David talking about the funding of this asset. So I think you can see it's possibly something that is needed in the practice, and I'll pass back to David now to allow him to show you how to fund this investment. Thank you.
Thank you, Barry. Now, do forgive us for the little bit shuffling back and forward, but we were going to attempt a side-by-side sort of breakfast TV look, but we couldn't. We argued about who should be sitting on the right side and the left side, so we figured that this might be a better alternative. Now Barry's covered some of the technical advantages of looking at technology such as he described, and it's fairly obvious why we've decided to do it as a double act, because I don't think I would have been able to do justice to some of the magnificent benefits that this can bring. But why invest is the question that we've got to ask ourselves now. Well, you can save time and improve efficiency. You can increase the treatment options, and you can grow the practice and attract more patients. Why would you use finance to do that? Well, you can manage your cash flow more efficiently. It certainly is tax efficient, and we'll be looking at that in greater detail very shortly. And it allows you to obtain the most up-to-date technological equipment at today's prices. It frees up cash for other projects as well. The affordability test. Well, that's one that we'll come on to in just a second here. But the benefits of using finance to secure equipment, we actually do need to prove to you that you can actually afford it. Barry's shown us that it's a very desirable thing to have new equipment in the practice, but I have to prove to you that you can actually afford to do so, because many of you may be sitting there saying, wow, I would love that in the practice, but how can I really afford it? Well, let's have a look at what the actual finances look like. Now, it's a very simple, straightforward slide we've got up here. Your initial investment for the machine that Barry was talking about will come in at $38,000 plus VAT. Your monthly cost over a standard 5-year term would be £780 plus VAT, which comes out at £936 coming out of your bank account. Okay, so there's a figure to stick in the back of your memory for the moment, £936. And some of you may be thinking, well, that's not quite as much as you thought it might be, which is great. Others may be thinking, oh dear, I'm still not sure if I can afford it. Well, let's look at, can this equipment actually repay itself? Because the affordability test has to be looking at what treatment plans you can actually offer when you purchase this new equipment. If we look at an average cost of an implant, for which this equipment is perfectly placed to help you with, then let's take an average cost of around about £2,000. The already established cost is, including the VAT, £930 coming out of your bank account. So you could be self-funding with 1 to 2 additional implants per month. Now that has to be a wonderful example of how you can achieve that. Now, 1 would cover your actually outlays, and 2 would certainly put you into profit. Now that's a sample of a 5-year term, and obviously there are other terms available up to 7 years. Okay, so tax implications. Let's have a look at how the tax can do. We've looked at break-even figures, and you can see that affordability is confirmed even with very modest additional treatments. As we're well aware, an investment in capital equipment will actually qualify for tax relief in your practice, regardless of your trading style. So what are the tax implications, and can your practice benefit, and do the benefits differ between different trading business styles? Yes, indeed they do. I'd like to look at how you make the most of your annual investment allowance. We made reference to that phrase earlier on, and although it may be confusing, an annual investment allowance is, it's simply a different way of describing how you get capital allowances as they used to be known. The qualifying assets, such as the cone technology we're talking about, is classed as capital expenditure, and you claim tax relief from the capital expenditure using your annual investment allowance. Tax relief is allowable against taxable profits on the full purchase price, including VAT. One of the many things that I hear over the years about dentistry is, oh dear, we wish we didn't have to pay the VAT. Well, one of the minor benefits is that actually it's a tax allowable expense because you can't claim it back. So let's tick the box in the positive of that particular thing. There is an annual investment allowance with an upper limit of £200,000 per financial year. So the £38,000 plus VAT that Barry talked about, it comes well underneath that. And what annual investment allowance does actually give you is full tax relief in the year that items are purchased, rather than over several years as it used to be. That generates a significant cash benefit for your practice. Now, we'll come to some of the numbers in a second or two, but some of you may be familiar with the old way things worked in terms of claiming your capital allowances. And that was, you used to claim 25% of the purchase price in year one against tax, 25% of the remaining 75% in year two, and so on and so forth. Meaning that all your tax allowances, tax relief was gained. It's exactly the same tax relief as you get using your annual investment allowance, but used to take normally between 7 and 10 years to claim back. So this is a major advantage to you under current government legislation. Annual investment allowance is a very confusing item, as this chart, and I'm not going to ask questions on this chart later on necessarily, but it's just to give you an idea how the government has played about with the numbers over the years. You can see from the bottom chart it started at 50, went up to 100, was down to 25 in each financial year, then up to 250, down up to 500, and then now at its current level of £200,000. The HMRC state on the website that the current annual limit of £200,000 is permanent. So were all the other numbers as well. So I think watch this space, because there is some talk about that amount actually increasing again in the autumn budget. We need to wait and see on that. But if you are confused over the numbers, then I'm not surprised, because it's been a confusing few years for everybody to get their heads around it. But the current number is £200,000, and I think that would cover almost any practice expenditure that you may have. So let's see how that actually works then. The annual investment allowance. Your example on the piece of equipment we're looking at here, which is GXDP 800, you look at the table on the right hand side, confirming the numbers we showed earlier on, there's the equipment cost and your monthly repayment over that 5-year term. Now your tax relief is available against taxable profits, and the cost allowable would be 40% of the cost of the equipment at £45,600. So your tax relief available is £18,240. So your net equipment cost is therefore £27,360. It's a pretty straightforward calculation to make. Obviously, there is an assumption there that you're a 40% taxpayer. If you're a low rate taxpayer, obviously your tax is gained at whatever rate of tax you pay. If you're an additional rate taxpayer at 45%, then woohoo, here's a little bonus for you, because your tax relief may even be more significant than is shown on the screen. I would note that many of have incorporated businesses, and obviously in your case it would be the current corporation tax rate, which is 20%, and that's actually going down, a good thing, from 2017 down to 19%. So as currently stand, the above tax relief figure should be half, but still represents a significant cash flow benefit to the practice. So as I said there, it is your tax rates appropriate in the year of purchase upon which you will base your tax relief. Interest is also allowable against taxable profits and reclaimed over the term of the agreement. And in this case, we're looking at 5 years. Any interest payable will be reclaimed over that 5 term. So hopefully you can see, despite the fact it's a fairly confusing tax benefit, or can be, maybe more so over the years when it changes, it remains a wonderful opportunity for the practice to reduce their tax bills and invest in up-to-date technology. It really covers all bases. There's further good news as well. You're still unsure? Well, you may well recognise the clinical benefits to you and your patients of 3D investment. You're still unsure the practice cash flow, however, can cope in the short term. In which case, we do have on offer a deferred payment option. And that's fairly straightforward. Don't make any payments or much lower payments for an agreed period in time. And obviously, because you obtain the equipment on day one and sign the finance agreement on day one, then you're still entitled to make use of your annual investment allowance. So even if you think, wow, I'd love to see that technology in the practice, that isn't that much. I didn't think I thought it was going to be a bit more than that. But actually, right now, I've got a new associate starting in 3 months' time. Maybe I'll look at it then. then why don't you look at a deferred payment option? Still get your tax relief now in the year of purchase, but you make no payments for the agreed deferred payment term. Your payments can in fact be deferred until 2018 if you look at the deferred payment option which is available on an exclusive basis with Right Health Group. Right Health Group is known to you, I'm sure most of you. You'll either know it as Right Health Group, Rights or Right Cottrell, it's the same thing. And so KaVo combined with Rights and ourselves to offer an even better benefit, which is nothing to pay at all until 2018. And again, I can't stress enough, you obtain all the clinical advantages through practice now, and you avoid potential equipment price increases. I say potential equipment price increases. I can guarantee there are going to be equipment price increases. Having spoken to many of the manufacturers and dealers, because the pound sadly has depreciated against all of the currencies out there, especially the euro. So price increases are en route. So take advantage of this particular offer now. It gives so many advantages to the practice. One cautionary tale about the annual investment allowance. It's fantastic, as we just explained. But if you're about to start a new business and your projections show only a small profit, or indeed a loss in the first year, then utilising your annual investment allowance needs to be approached with caution. The allowance is attributable to taxable profits, remember, and these are sufficient in your first year, according to your business plan, to use all of the available allowance. And you could lose out as they're not normally available to carry forward. So it's not as if you can carry forward allowances that you don't use in the year of purchase. So you need to be very careful with that. We do have the other finance product, because to take advantage of your annual investment allowance, you need to have a hire purchase agreement. I should have stressed that at the beginning, actually. Hire purchase is the route to obtaining annual investment allowance. With a lease, where title is not normally expected to pass to the lessee, which is you yourself, the dentist, then the monthly payment is what attracts tax relief. Okay? And that means quite simply that instead of getting all your tax relief in year one, you spread it over the course of the agreement. So it's 12 times in a full tax year, 12 times a year the repayment is the way you claim your tax relief over the course of the agreement. And that may well suit startup businesses better than trying to use your annual investment allowance, which may actually be wasted. You, depending on which equipment we are talking about, of course, it would be difficult to split some on HP and some on lease on the cone beam technology we discussed there, but it could entirely be possible on other equipment. Doing part on HP to utilise what you expect your annual investment or your taxable profits to be, utilising your annual investment allowance, and then the balance of the equipment on lease to spread over the remaining term. And the same would be true, the same is entirely true if you've already spent £200,000 on your business in the current financial year. I'm afraid you don't get any more than the financial year, you would have to wait until the following year to take full advantage of your annual investment allowance. So I think what we would always say to people is, have a look. You know, if speak to Braemar and your accountant, and we can actually point in the right direction, make sure you get the facility which best suits your circumstances. So we've looked at the benefits of having the equipment, we've looked at the cost, we've looked at the fact that with equipment such as we're looking at here in cone beam, you need to do very few extra treatments to make it pay for itself. And if you fund the benefits to your cash flow from the annual investment allowance, then it really doesn't make sense not to invest in equipment now. So how do you go about the finance application process for those of you who may be unfamiliar with it? And it's pretty straightforward if you're dealing with a firm specialising in dentistry. We do know, for example, that you're not VAT registered. You go to a non-specialist, expect to ask them to ask for VAT as deposit. That's not entirely unusual at all. However, responsible lenders are required to ensure that affordability of the proposed investment is confirmed. This is government legislation brought in since the credit crunch, and responsible lenders are ones who need to make sure that you can actually afford this investment. So we will sit down and discuss this investment with you. And the level of information we require will vary from business to business and circumstance to circumstance. We've done a very quick flow chart here to try and talk you through the process. And as you can see there, Braemar has a network of 9 area sales managers, and you would initially discuss your application in detail with them. To ensure that application goes through on a speedy basis, we would require some or all of the following information, as you can see there. The trading style of the business, some personal details, all of which can be done on a verbal basis, date of birth and financial information, which may mean business accounts. Now, larger proposals may also require bank statements of assets and liabilities. Again, nothing to be frightened of there, but again, this does ensure that we cover our legislative requirement to confirm affordability. New start practices would also require a business plan and cash flow projections. That's almost a given. Now, you shouldn't be concerned about this because there's a sense of proportionality here. If you're looking at buying some handpieces and you've been in business for 20 years and the sum that you require is £1,000 for us to finance, I can assure you we certainly won't be asking for accounts and any of the other written statements that we're looking at. Be done on a verbal basis because that's appropriate for level of investment. And really, that is what needs to be kept in mind, is it's a level of proportionality. Outcome and underwriting process will be communicated by Braemar support team and or your area sales manager or both. And provided we have all the information required, how long does it take to give you an answer? Well, we aim to have an answer to our clients with a maximum of 8 working hours. And that is our internal and certainly broadcast turnaround times, and we do in over 98% of the time fall within those 8 working hours. So you can see it's not a long drawn out process. The finance process itself is finalised when a finance agreement has been signed by the business owner, usually following receipt of an invoice from your chosen supplier. So hopefully we can see that if you think that you may well be looking at making an investment, the proceed's very, very straightforward and will guide you every step of the way. Now, one thing you can do prior to applying for any finance, and I do mean any sort of finance, is understanding what your credit report means. Because in every credit application, then a copy of your credit report will actually be applied for. I think we need to cover some sort of misconceptions here. There is no government agency which holds all of your credit information. These are commercial bodies which hold them, and the 3 are detailed here on the slide that we're looking at now. Experian, Call Credit and Equifax, and their web addresses are up to your assistance. Now, finance companies will apply to one or sometimes more of these companies for a copy of your credit report. And that credit report will contain a great deal of information. You can actually apply for a copy of your statutory credit, and it does say score there, that's a typo, that should actually say credit report. For the statutory credit report, every single one of us is entitled to get a copy of that from any one of these agencies, and it costs you £2 to get. It's very straightforward to do, and I would commend that to you, because I have to say that the difficulties that can be come across when there are errors or some adverse information in the credit report makes life extremely difficult for you. So what you need to do initially is check that the information held against your name is indeed correct, and I'll just point out a couple of areas where it can cause you difficulty. If your file is clean, it will make the process of obtaining finance much easier. If you've got missed payments on credit cards or loans, or you've got redundant cards where you've still got, it looks like you've still got access to lots of credit, but you've never used the card for several years. If you've got lots of recent searches on your account, which do show for up to a period of the last 12 months, or if you have no financial information at all, conversely, if you're not on the voters roll or electoral register, as it's more properly known, and if you've got large balances in credit cards, All of these can adversely affect your credit report and your ability to actually get access to credit. So I think it's hugely important you get a copy of your statutory credit score. I do it once a year and just double check that everything is absolutely spot on. If you do spot something which is wrong, then you can actually make application to the Credit Reference Agency and they will give you full details as to how to apply back to the company that's lodged adverse information against you, and you can obviously have that corrected, which is a worthwhile thing to do. If, however, you look in the mirror when you've had a copy of your credit report and you think, oh, actually, yep, that is me after all, and I have been late with credit cards, oops, then all you can do is start to clean up how you handle your finances. Start to pay your credit card on time. Stick that in a direct debit if you're somebody who sticks it in the top drawer and means to get back to it next month. By doing so and changing your behaviours, then the information that's held in your credit report will actually be much better, and there is more weighting given to how finance companies view your credit report on most recent information, which kind of makes sense. So, as I say, your credit report is hugely important. I'm sure we've done that one today. Now, there is a way to help fund your investment even further, and that is to use treatment plans within your practice. Because I think what we've looked at this evening is the clinical and practice benefits covered by Barry earlier on very well, and this looks like a piece of equipment which would be a real benefit and a boon to your practice. We've covered how much that will actually cost you coming out your bank account, as an example. We've covered the many tax benefits that are currently available to you. We've confirmed that you can actually defer payments should practice cash flow dictate that that might be an attractive option to you. And we've shown how easy it is to actually apply for finance. Now, if you just think about it logically, having done all that and get your nice shiny bit of equipment in your practice, how do you actually go about making full use of that nice shiny bit of equipment? Well, your patients won't know about it unless you tell them. And basically, one of the easiest ways to do it is to offer treatment finance within your practice. Now, Braemar just happens, of course, to have a fast track option. It's one of the facilities that we've done for many, many years, and I'm pleased to say it's an online application process to be paper-based and provides you a decision within seconds. It's quick and efficient to use. Your patient can apply, and this is entirely the practice's decision. You can apply while they're in the practice, but we do realise that in some circumstances, in some practices, you just don't have the facilities or the room to actually do that at front desk. So in which case, it's very easy to give your patients a reference number away with them on the mobile phone and or email, and they can apply in the comfort of their own home, perhaps after discussion with a partner as well. So from your particular point of view, once you've got the acceptance through, you can obviously schedule the treatment plans immediately, and it may enhance your practice cash flow. In fact, it almost certainly will. So let's summarise those benefits then. You've got a 24-hour, 7-day-a-week online credit application. It's paperless and a rapid payout, so there's e-signatures available there. By doing so, the bad debt is obviously managed by Braemar Finance, and we'll take that one on the chin. The practice is paid in advance of the treatment course. So once the patient comes in for the first course treatment, that's when you action within the system and payment is made in full to the practice at that point in time. Another nice little bonus to it is we do provide full training. There's training on a remote basis with our team up in the office, but also with our area sales managers who will come out and provide additional training, and for that with some useful verifiable CPD. Now I know many dental surgeons will have lots of opportunities for CPD, but I do think many of your dental nursing staff, especially verifiable CPD, have very little opportunity for it, and it's certainly available for them as well. So why use Fast Track? You can bring forward or upsell treatments. I know upsell and the word sell can sometimes get some of you shaking your head, but actually all you're doing is upselling treatments which you've already agreed with the patient they actually want, because you've shown them, as Barry said, in the technology available, and they've said, yep, I really would like to look like that for my daughter's wedding, my son's, whatever it is, and you're now offering them an opportunity to make it affordable to them. So affordable solutions for your patients is actually what is one of the major benefits for you. I know that many of you, despite your best efforts at front desk to try and get upfront payments, take staged payments for treatment, and I also hear anecdotally from many of you that getting the last payment out of patients is extremely difficult at times. So staged payments, you don't need that, you've got your cash flow benefit up front. The Braemar proposition gives you a dedicated team providing business hours coverage. Obviously it's a 24/7 application process, but in terms of what your practice team might need, if they hit any problems, well, we've got a support team there, and as I say, we've been in business for 25 years. Many of the staff have been with me for at least 22 of those years, God help them, and there's nothing they wouldn't be able to help you with. It is a simple and quick process, and full training is provided to the practice team. Just as a final point on increased patient uptake, there's a testimonial from a practice that switched to us fairly recently, and I can't say any better than that we've doubled the number of patients using finance, and it's helping to further develop their business, giving patients what they want when they want it, and obviously, as they said, but not in that testimony, it's making the dental practices work much more enjoyable, and I'm sure that's something that most of us would aspire to as well. So you've got an increased uptake of treatment plans, a reduction of added doubtful debt, and most importantly, payment up front when the treatment starts. It really is genuinely a wonderful practice builder. And just as a final point with regards to that, I do hear many stories where I speak to them at exhibitions perhaps, and they'll say, well, we don't have a call for that in our particular practice. And when the dentist slips away to the side to speak to one of my colleagues, I'll speak to them to the practice team, which quite often are there accompanying the dentist around the show. And they tell a completely different story, where there's a slight disconnect between dentists' chairside suggesting or agreeing, as they thought, with a patient that a treatment plan of, say, £3,000 would be a good idea. The patient says, oh, wonderful, I really want to look like that. By the time they've gone downstairs to the front desk, the front desk staff quite often tell me that the conversation goes along the lines of, yeah, look, I'd really like that expensive treatment plan, but book me in for a scale and polish, and give me some of that whitening toothpaste, and I'll think about it when I get home. And to be honest, most of them don't ever come back and take that up. Not because they didn't want it, but because you didn't make it affordable for them. And I think that Fast Track really just does absolutely tie up the loose ends with regards to what you're looking at this evening, which is the clinical benefits of e-technology, the tax benefits, the cash flow benefits, the practice benefits, and the benefits to your patients. There's not anybody at all who doesn't benefit from utilising this technology. Now, we will go on to the next slide, which is looking at quiz questions. That will come up shortly after we're finished. That's a sneak preview of it. There's a quick overview of what the Braemar coverage is. A lot of hands, of course, we've got a lovely Gail in the middle there for those who are lucky to live and work in Scotland. And obviously we'll be more than happy to discuss any requirement you may have. Just as a finishing point as well, as I indicated to you, thank you very much for attending the webinar. It's my first one, which may be entirely obvious to you, but we're celebrating 25 years of trading, and as part of our celebrations, we've got a free competition to win a luxury overnight stay for 2 at Glen Eagles, and there's a hyperlink there, which I'm sure you can, at your leisure, or indeed is available via our website. I'm finished for this evening, and I'm looking for any questions and answers, looking for questions, which we'll do our best to answer. If there are any questions that you have not had time to put forward tonight, or you feel would be better addressed on a one-to-one basis, then Barry or I have contact details on this particular website, and be more than happy to answer them direct. I don't see any questions popping up just now, which either makes me think you don't have any, or you've answered all of them over the course of this evening's talk. Okay, on that basis, let's not drag it out. There will be opportunity for you to get your CPD points after this, and thank you very much and good night. Sorry, there has been a question crop up. This one for Barry.
So yeah, so the question is, how about radiation exposure compared to IOPA? I mean, radiation exposure is something we need to be extremely careful with when looking at these pieces of kit. They are probably the highest exposure we're going to give to a patient, both from a patient's perspective and a radiation protection perspective within the surgery. We work with a very good team of trained engineers, trained installed at our dealer network, which will advise, which will discuss with your own radiation protection advisors regarding the radiation protection side of things. And if there's any questions, any discussion points, we generally get to those before the equipment is installed, so you are completely clear, and your radiation protection advisors are completely clear. Does that answer your question? Okay, it looks like there aren't any more questions coming through. So without further ado, I'll wish you a good evening, and thank you for listening.
We would like to thank our speaker for sharing his knowledge and expertise with us today. We would also like to thank our sponsor for making this online course possible, and thank you, our wonderful audience, for your interest and participation. The CE quiz is now available online on the course page, and completing it will allow you to earn your ADA CERP CE credits. The recording will be posted online within the next 48 hours. You will receive an email notification with a link to the recording. Thank you again, take care, and goodbye.